They say heart attacks announce themselves with pain, but most don't. Sometimes it starts as nothing. A dull pressure in your chest, a tightness you brush off as indigestion. You shift in your chair, tell yourself, "It's fine. I felt worse before." But this time it lingers. Your hand drifts toward your heart, almost instinctively. The air feels heavier. The room seems quieter. Your body knows before your mind admits it. Something is wrong. You freeze, waiting for it to pass. Denial fights reason. Should I call someone? Should I wait? The seconds stretch, your heartbeat echoing like a clock counting down. And then, a realization hits you. No one's coming. You're alone, and every decision you make right now matters. This is the invisible line between life and loss. What you do in the next few minutes can decide whether your story ends or continues. Most people believe a heart attack always starts with crushing chest pain, but that's the myth that kills. The truth is, many begin quietly, disguised as something harmless. You might feel pain in your jaw, shoulder, or back, maybe a strange pressure behind your breastbone, or a wave of nausea that feels more like the flu than danger. For others, it's shortness of breath, like suddenly being unable to finish a sentence without gasping. Robert, 68, remembers it vividly. He'd just finished dinner when a dull ache began in his arm. Probably indigestion,
Yes, I need some assistance,
he thought,
please.
sipping
I'm
water.
Helen Smith at number 42.
15 minutes later, he was drenched in sweat, dizzy, and struggling for air. By the time paramedics arrived, his heart had already stopped once. But there's one signal almost no one talks about. A deep, sudden fatigue that feels unnatural, like your body just powers down. It's your heart struggling for oxygen, sending one last quiet warning. Only half of seniors feel that classic chest pain. The rest get these subtle signs. Recognizing them isn't about fear, it's about giving yourself a chance. Because when your heart whispers, listening could be the choice that saves your life. Hesitation is the enemy of survival. Most people who die from a heart attack at home had one thing in common. They waited. They told themselves it was just gas, or fatigue, or anxiety. But in those lost minutes, the heart was starving for oxygen. Statistics show that half of all fatal attacks could be survived if help arrived just 10 minutes sooner. 10 minutes! That's the line between life and loss. If you even suspect something is wrong, call emergency services immediately. Don't try to be sure. Let the professionals decide. It's better to be wrong and alive than hesitant and gone. If you live alone, make your phone your lifeline. Set up quick dial numbers for family, neighbors, and 911. Enable voice commands. Even a whisper of "call for help" can activate your phone's assistant. Keep your device nearby, always charged, always within reach. Fear of embarrassment kills more seniors than the attack itself. You don't have to be brave. You have to be fast. Because every minute you wait, heart cells die. And when your heart stops, so does every moment you might have had left. Calling early isn't panic. It's power, and it could save your life. If you ever feel those symptoms hit, the way you position your body could decide how much time you have. Most people's instinct is to lie flat, but that actually puts more pressure on your heart and lungs. Instead, sit upright, with your back supported against a wall or a sturdy chair. Keep your knees slightly bent and your head elevated. This position eases the workload on your heart and helps blood flow more freely to your brain. Picture it like this. Your heart is an engine struggling to stay running. Sitting upright takes the pressure off, giving it the space and angle it needs to keep pumping just enough to keep you conscious and alive until help arrives. Take Helen, 72. When her chest tightened suddenly one night, she remembered this position from a safety video. She propped herself up, called for help, and stayed conscious until paramedics arrived. Her doctor later told her that simple choice, sitting up instead of lying down, likely saved her life. When your heart falters, stillness isn't safety, it's strategy. The right posture buys precious minutes, and in a heart attack, minutes are everything. Sometimes survival isn't about doing more, it's about doing one thing right. You've probably seen the claim online. If you feel a heart attack coming, start coughing hard and you can save yourself. It's dramatic, shareable, and dangerous. This so-called cough CPR trick sounds empowering, but in truth, it's one of the most harmful myths out there. The idea comes from a medical procedure used only in hospitals, where doctors track a patient's heart rhythm in real time. In those cases, a controlled cough can briefly stabilize the heartbeat, but without medical monitoring, it can do the opposite. When you cough violently during a heart attack, you are increasing pressure in your chest and starving your heart of the oxygen it is already fighting to get. Instead of buying time, you may actually shorten it. So, what really helps? Something far simpler. Steady breathing. Slow, controlled breaths calm your nervous system, conserve oxygen, and prevent panic from spiking your heart rate further. Misinformation like this spreads because it sounds like control in chaos, a secret move that feels heroic. But the real strength is in calm action, calling for help, sitting upright, breathing slowly, and staying alert. Forget the internet tricks. When it's your life on the line, truth, not myth, is what saves you. If you've made it this far, take a deep breath, because what you know now could one day save your life or someone else's. Surviving a heart attack isn't luck. It's awareness, calm, and action. It is the quiet strength to recognize what your body is telling you and the courage to respond without hesitation. That's what turns fear into focus and uncertainty into survival. Picture your future self, the one who acted fast, who remembered the signs, who refused to wait. That version of you doesn't just survive. They live on to tell the story, to hug the people who would have lost them. You're not powerless, you're prepared. And that preparation? It's a gift, not just for you, but for everyone who loves you. So, don't keep it to yourself. Share this video with someone you care about, a parent, a neighbor, a friend. Because awareness spreads faster than fear, and when knowledge travels, lives are saved. One day, when someone you love recognizes the signs because of you, your future self will thank you. Thank you for watching. Please like, subscribe, and stay safe.